Hello, everybody. Today I'm addressing a rather very different topic on healthcare here in the United States. Now, before I get started, I want to say the following. The assassination of Brian Thompson is tragic and sad. And I strongly believe that no one should be killed for those reasons. And we should not be killing anybody for any reason. I don't even believe in capital punishment. I'm a pacifist. So I believe that we shouldn't even be having wars. I also empathize with those who have expressed indifference to this killing. I think this has developed because of a very bad health insurance in America for most people. So therefore, people are very frustrated with the system. This is why most people reacted the way they did. You can condemn the death and the killing of Brian Thompson and feel sad for him, and I do see his death as tragic, and at the same time empathize with those who are indifferent, even those who celebrate for some wild reason, which I believe you shouldn't. But you can empathize with those who do and understand where they're coming from. If you have a close relative who you feel was affected badly by health insurance and the convoluted rules that I'll talk about in this video, this could be the reason why people are reacting the way they do. I'll go into detail more about the solutions to the healthcare problem. What are the ultimate solutions that could satisfy most people and at least prevent people from perceiving the health insurance companies as evil? This video is addressing mostly those who may work in the health industry, asking themselves, why do people hate us so much? Why are people so angry? Andrew Whitty, the CEO of United Health Group, seems not to understand that. And so my video is partially responding to him in relation to what he stated. It's very important that healthcare companies listen and listen to people's complaints, because many people have attempted to explain to people why this is wrong. Governor Shapiro of Pennsylvania attempted to explain why he thought people were being bad about this and were mean-spirited. It has not worked. It has not changed people's minds. People are angry. People are frustrated. So my goal is to explain. If I was sitting in front of somebody who works for a health insurance company or in front of a health insurance executive, and I was talking to them, what would I tell them? What would be the reasoning why people are so angry? This is what this video is about.
What would improve American health insurance quickly?
The best way to improve health insurance is to make health care free at the point of use.
Why are many people now using the CEO's assassination to lash out about healthcare? There are ways to protest peacefully without celebrating violence, isn't it?
People have been addressing the problem of healthcare for years. Look at all these YouTubers. I can list them. I have them in the pictures. You can see that. I also have links in the description. You can look at them. Some of those videos are long. And that's just scratching the surface. There are a lot of activists out there who've been talking about how bad the healthcare system is. Bernie Sanders has been talking about Medicare for all. There have been others who've been talking about some sort of universal health care. And yet, nothing has been done. So this is not the first time that this anger has been expressed. It has been expressed many times, and there has been no response. Lawyers, patients, doctors, etc. have complained about the system to no avail. In other words, people are literally getting screwed over.
Before you get screwed over by our health insurance, would you like some wine?
What did Andrew Whitty state that makes you feel that he does not care about patients?
Andrew Whitty lacked empathy for the patients. He might as well have said, "We are here to screw over the patients." He might as well have said that. That would be a little bit more direct. I would have respected him a little bit more if he'd said that. At least we know what they stand for. He said they cut costs and remove unnecessary treatments or expenses. Basically, United Healthcare decides what kind of treatment each patient should have instead of their doctor. Do you remember around 2010 to 2013, those who are old enough, those who are millennials or older, do you remember when they had what they were talking about, which was like death panels, right? Where it was this threat when we were talking about, I think that's one of the criticisms of Obamacare, that there would be these death panels where the government would sit down and decide who would get treatment and who wouldn't. Well, those death panels, you might as well have said those death panels already exist. Because to be honest, if you are deciding what treatment, right, what treatment each patient is going to get, if you say, okay, you can't get this drug, you're going to get this drug, even though your doctor said this, go to another doctor, even though you, the patient, haven't made that decision, that's literally almost like a death panel. And if your treatment can be denied by an insurance as a necessary treatment, that is very bad. I will give an example. This involved a different company called Cigna. This happened in around 2007. So Natalie Sarkeesian, she needed a liver transplant. She was 14 at the time. She was born in 1990. And she was diagnosed with leukemia. Doctors at the UCLA Medical Center, they recommended that she gets a liver transplant. And there were actually 2 livers waiting for her. But Cigna refused to pay for it, saying that it needed to have a more than 50% chance of survival in the next 5 years. The problem was that this was a new treatment. You know how treatments especially for cancer treatments, you need a lot of time and to see a lot of data. But sometimes a treatment can be excellent, but it hasn't had a long enough time to basically show that fact works. But it did show that it was over a 65% survival rate in 6 months. Well, their Cigna said, nah, we can't use a drug. They considered it an experimental drug. But there was so much public outcry. Finally, Cigna rescinded the decision. But they rescinded the decision in 2007. It was too late. So a few hours after the operation, because it had been too late, Natalie died. Parents did try to sue, but they lost. Basically, the way it works is that because this is a coverage that the employer bought, you can't sue the health insurance company because that your employer bought the coverage. It's basically, that's how the court system works. I'm going to do a long story on this and explain what happened. I'm still digging and doing some research on what the court order said, so that you're aware of this. But basically, the health insurance company Cigna killed Natalie. I'm sorry to say that. That's just how I see it. They killed her. And, they did it by denying the coverage that she needed, and only later on rescinded it. They delayed coverage, is a better way to say it. And that is deplorable. So that's what Andrew Whitty talks about, cutting costs. Cigna did cut costs. They delayed the treatment for 3 years. And by the time they allowed the treatment, it was too late. It's so sad because Natalie might be still alive today. And I'll say she probably would be still alive today if it wasn't for that denial. How many stories like this exist? Why should a health insurance company be the one to decide who gets coverage? And that's the issue I had with Andrew Whitty, is that he lacked empathy. He did not remember cases like the Natalie. He must have heard about that case, even though that didn't involve his company. I'm pretty sure there are similar stories with United Healthcare. I'm willing to bet there are probably more stories with United Healthcare. And nobody even is able to sue because there's no such public outcry as we had with Natalie. If you wait too long for treatment, you can die. If you have stage 2 cancer, it can become stage 4 cancer. People die when you wait for treatment. People can become paralyzed, disabled. Their legs can end up being amputated, or their limbs can end up being amputated because you waited too long. You're waiting for a prior authorization before you get treated. By the time that authorization goes through, it's too late. So one would ask, what should happen?
What should be done to prevent tragic cases like Nataline's case?
And this is a good question. What should happen? What should health insurance be doing? Well, health insurance should be paying. Their job will be to pay for the treatment of the coverage, period. The doctor makes the determination of the treatment and the cost, what drugs are needed to be used for that treatment. Okay? The health insurance company pays for that. That's the job. It's not to challenge what the doctor is saying. A qualified individual who knows that person, who knows you. My doctor knows me better than any health insurance company, because the health insurance company is not here with me to determine what I need. It's between me and the doctor to determine, okay, this treatment, okay, fine, I'll go ahead and do with this treatment. That's how it should work. The case of Natalie is tragic. But health insurance companies have not stopped using delaying, denying, and in some cases, literally dragging you through the courthouse. And by the time you finish with your case, the person who's involved is either deceased or the families just gave up.
Do you personally have bad experiences with healthcare?
Yes, I do have personal experience of health insurance companies literally going over. Yes, I do. Now, my experiences were not severe, so I'm not going to overrate them compared to other more serious cases that I've read on different channels. You can look at some of those experiences that I've read. I'm going to post them here. I don't have time to explain them, but there are a lot of people who've written heart-wrenching stories that don't compare to mine. So I've been lucky, I've been healthy. When I didn't have insurance, or I had very bad insurance, I was healthy, I never got sick. Except I rarely got sick, let's put it that way. But I did have 2 experiences. One was when I was in school and I went to visit. I think I needed to get tested in something. I needed some vaccine or something. I forgot what I needed. I don't remember. But this was in school. And I went there and I did it. It was something I needed to do. But I ended up, apparently I had school insurance, but I ended up still having to pay, I think it was like $55 at the time. It was in around 2004-ish or 2003-ish. It was like $55. Now you might say, oh, $55 is not a lot of money. Well, when you're a student, like I was, that relied completely on scholarships and financial aid, I did not have that money. And at the time, I was looking for a job. I didn't even have a job. I was trying to get a job, but I couldn't. Right? It was difficult to get a job. So I was trying to get a job. I was completely in school. I had no money, literally no money. And fortunately, I did get treated, but I ended up with the bill, which I never paid until way later. Then another experience which I had was I had an extreme back pain. as extreme as was shown by some, but not that extreme that they put screws in my back, but very bad, where you have those spasms and you can barely move, you can't do anything, you're walking really slowly, that kind of back pain. And I do remember saying, this is too much, so I decided to go to agent care. They said, oh, your insurance checks up, because I had to check my insurance to make sure it was really good. It's really good insurance. Okay, this was just a year at work, started working in this new organization that had great insurance. The insurance, by the way, I have is probably the best, one of the best, if not the top-notch insurance that people can get, okay? So I go, I'm like, oh, wow, it's pretty cool. I'll get out. As I'm going out, they say, oh, okay, you do need to pay $150. I was like, and I was in so much pain, but I had my credit card so I could pay. I was imagining what could have happened if I didn't have that $150. Okay? What if I did not have that $150? Because the lady was not ready to give me, she did not give me the prescriptions or anything until I had paid. So would they have said, okay, you can go home and come back for the prescriptions after you find the $150? What would have happened? I've always asked myself that question. And I have no answer. Would they have sent me home and say, hey, you go to emergency room because it's not going to work out? Is that what would have happened? So yes, I've had some experiences. They weren't bad, but it was eye-opening. It made me realize, be very careful when you go to the hospital. I'm pretty sure there's some things that required me to go to hospital that may haunt me in the future. I rarely visit the hospital, okay, unless I'm going for some physical or something. I literally, even if I feel like, I have a little pain here, I'll wait. I remember I had some injury because of my running, and I just waited until it healed. Unfortunately, it healed completely. But it could have been, I think it must have been a stress fracture or something. Some people say you should go to the hospital to have the doctor check it out. I did not have it check it out. I don't know whether this is going to haunt me when I'm 60 or 70 or 80 years old. I have no idea. But that's a risk I'm willing to take, because I don't know how much it will end up costing me if I go to a hospital and then they tell me, oh, okay, you have to pay this amount. I don't want to have an unexpected cost. I'm really wary of going to the hospital.
How can health insurance companies put patients first so we can avoid the nightmare scenarios previously mentioned?
Well, whether it is private or government health-based insurance, I don't personally care. We can argue whether the government should be the one providing health care. I don't care. I personally don't care about that. What I do care is that it's free at the point of use. However, if you go into a hospital, you shouldn't have to pay a single dime. I shouldn't have had to pay at the urgent care. I shouldn't have to pay anywhere. But technically, it is for health insurance companies to make sure that the services that the patient receives are paid for. Okay? They have to make sure it's done that. Once a doctor determines that this is what the treatment is needed, the doctor should immediately be able to give the treatment within the time frame that the doctor prescribed, not the health insurance, the doctor. If the health insurance company think there's fraud, the onus is on them to prove fraud. They can do their investigations. They can do their private research. When I worked for a workers' compensation insurance company, which dealt with compensation disability insurance, they would send people to see if the person is actually claiming care is legitimately claiming care. There were people who investigated that. That wasn't in my department. All I did was approve. So if a person qualified, they made all the criteria, I just approved. We did not assume that they were lying. We did not say, oh, these documents are fraudulent. No, the onus was on us to prove that there was fraud, not on the person who was asking for coverage. What more health insurance? Health insurance, the patient should not have to prove that they need treatment. The onus is on the health insurance company to prove that the patient does not need that treatment. It could be that the doctor is forging papers, and I've never seen that happen. Okay, I have friends who are doctors. I have friends of doctors. I have one of a close friend who's a doctor. I can guarantee you he would never sign a letter for fraud on my behalf to say, oh, Chindi has this disease and he doesn't. Because that would be risking him losing his doctor's license. It will just never happen. So I don't understand where these health insurance companies think, why they think that most people will be committing fraud. I don't understand it. I think that's what kind of Andrew Whitty might have been insinuating. No deductibles. Okay? You have a deductible of $2,000. How are you going to come up with that? No deductibles. How do you avoid deductibles? You have to standardize the health insurance offers. So there are things we know people are going to need either now or in the future, regardless of who the person is. That at some point, the older you get, the more likely you are to have these things. I am right now in my 40s. Okay? The health I had when I was in my 20s or even in my early 30s especially, that no longer exists. Okay? I don't have the same type of health. Even though I exercise and I'm strong, I don't have that same type of health. As you grow older, your health begins to slightly decline. Even if you're exercising, it'll slightly decline. This is why you rarely find a 48-year-old playing basketball in the NBA. I don't think I've seen one, okay? Because you're just not going to be as good. So, we know people are going to need this treatment. Insurance companies know that. There is no point of trying to say, oh, you're not going to need health, you're never going to need health insurance. Companies need to offer a standardized service that says, hey, if you have this disease, if you have cancer, you're going to be fully covered. If you have diabetes, you're going to be fully covered. If you have this disease, you're going to be fully covered. You're going to be fully covered if you have these diseases. If you want a nose job, you probably either need to pay for it yourself, or if you wanted to have no job, you thought you were going to have a nose job at some point, maybe you should have some extra coverage. If you need you want to expedite. There's some people who might need some sort of knee surgery. You are able to walk. A young friend of mine can't run anymore because he has a knee issue, and he was told that in order for him to be able to go back to running, he would need to have knee surgery, but he would still be able to walk. He's able to walk properly. You can't even tell he has a knee problem. And he's decided he will wait to have that knee surgery until he's in his either late 40s or early 50s. He's still young. He's in his early 30s. So that's his choice. But maybe he might want to have expedited knee surgery, right? So the doctors have said, that knee surgery can wait for however many years. That's it. If you want to have expedited knee surgery, okay, you need to pay for that. Or, okay, you want expedited knee surgery, you want expedited care whenever you need knee surgery in the future, sure. You pay an additional $15 or $20 for health insurance. Health insurance companies can work around those and say, okay, here your doctor said you can wait for 10 years, so we'll wait for 5 years before we pay for it. That's totally fine because the doctor said this can wait. It's as determined by the doctor, not the health insurance company.
Who will pay for this health insurance, which is free at the point of use?
We collectively pay for health insurance. This is something that happens. That's what we do. For example, we collectively pay for Social Security here in America. We have no issue with paying for Social Security. Why can't we pay for each other's health? We have no issue for paying for Social Security, even though many of us, most of us, are probably not going to reach Social Security age. Okay, a lot of us are not going to reach Social Security age. Some of us are going to die before we reach the age of 67. I think by the time I'm old enough, it might have even gone up to 72. Most people are going to die, a lot of people, not majority, but a large number of people, maybe 20, 30%. But we do this collectively. Okay? Health insurance money should not be made by denying a third of the people that have coverage like United Healthcare does. You pay into a company for many years, like United Healthcare was paid, and then you get denied. That is ridiculous. okay? Because the contract is made in such a way that there are always ways to deny you coverage. This is your health. This is not like they're taking your money away. It's not like life insurance or some other type of insurance where you can just say, you know what, I'll just eat it, like car insurance. Like, you know what, I know that they're not underpaying me for a car, but that's fine. I'll find some money and I'll go borrow money from the bank. You can't borrow health from somebody else. There are ways to increase health insurance in certain things where doctors say, hey, you don't need to get coverage. So I have a friend of mine who had fibroids, who needed fibroids removed, right? And the doctors say those fibroids can be removed pretty much at any time before the age of, say, 50. I don't know what age they told her. But basically, she's very young. She is really, really young. They were non-lethal. They were not painful at all. But she felt like they were not, she didn't feel that she would benefit a lot from her exercising because she exercises a lot if she didn't have these fibroids removed. So she finally decided she needed to have this expedited operation. So such operations, you can, as an insurance company, say, oh, you want that expedited? If you want your operations on non-lethal illnesses, such as you need your fibroids removed and the doctor tells me they can be removed at any time, well, you have to pay extra in your health insurance for this period of time before we can consider doing that, and we will see if we can accept. You can put loopholes in those selective treatments. You can do that. That makes sense because those are treatments that the doctor have determined are non-lethal. It's uncomfortable. You're walking with some sort of a cyst somewhere, but that cyst is non-lethal. Yeah, fine. You go ahead. You make the decision. You can make some determinations there. The issue most people have is with coverage that if you don't get treatment, you can end up dying. That's where the problem is. And health insurance companies don't take that very seriously. So yes, you can make money that way. If somebody wants a Brazilian butt or whatever, plastic surgery, whatever, there are actually insurance for that. It's a little bit more expensive. You can add that insurance. I'm pretty sure there are people who will be willing to pay an extra $100 or $200 a month because in the next 10 years or 5 years, they want to get a plastic surgery or something. So you can make money that way. You can also encourage exercising. I don't know why that is hard. There's actually a company, I think it's CDPHP. They have their own issues with the Albany Medical Center. I don't have time to go into that. I will go into that in the future. But basically, that company has done one thing right. They have a gym. They have some gyms where people can go to and exercise. It would be great if you have CDPHP insurance. You go there and you can get the benefit of exercising. It would be great if people are rewarded for doing that. So if you go to the gym and you exercise and then at the end of the year you do your physical and the doctor says, everything is healthy, everything is okay, you have no issues. Maybe your health insurance is your employer is paying $30,000 a year. Well, you've been exercising, you've been doing really well. Your employer is paying $30,000 a year. We're going to give you a cut of what your employer paid us. We're going to give you a third of what your employer paid us. Your employer paid us $30,000. That's what I saw in my about $30,000. We're going to give you a third of what your employer paid us. Okay, so if the employer paid $30,000, we'll give you $10,000 as a treat for being healthy, for staying healthy. How many people would be motivated to stay healthy, to go out to the gym because they want to get that $10,000 bonus from the health insurance company? If you were sick that year and you went to the hospital too many times, or you didn't get treated, now you might say, okay, that might force people not to seek treatment when they really need it. Actually, people who really need treatment would still go. Because if you're uncomfortable, you're uncomfortable. If you feel that there's something wrong, you feel that there's something wrong. So you still go to get tested. But it would also encourage people to exercise, to go out in the gym and stay healthy. If the doctor determines that you're not healthy, you're not eating well, you have so many issues, then you're not going to get that bonus. So that would help. I do remember I was in Japan and I saw in the factory people suddenly stopped and they began to exercise and stretch for like 15 minutes and someone was counting, I think, ichi, ni, san, shi. so that kind of thing, and counting until they finished, and then they continued with work. Maybe that's why Japan has the highest life expectancy in the world. We may need those kind of things. Maybe encouraging employers to have gyms at the offices, to have periods of time when employees can stand up and just walk around the place for like 30 minutes or 15 minutes. No work, you just walk around and chat with your friends and walk around. You have to walk though and do something. Maybe that could help. These are just suggestions to health insurance companies. This would reduce overall, if a lot of more people are exercising. So if the number of people exercising increases from say 10% to 40 or 50%, and those people also eat well, a lot of more people also eat well, the numbers of people that get sick will go down, which means the amount of money that health insurance companies spend to pay hospitals will go down, and then you won't need to have your 33% denial rate. For United Healthcare, you don't need 32% or 33%. You don't need that kind of denial rate. So it would be a lot cheaper to do that, to nudge people towards healthy habits, than it is to try and do 32, 33% denial rates, get people all angry, and then when your CEO dies, which is very tragic, people don't feel sorry for you. People have some sort of schadenfreude. People don't care about you. People even say very mean things that I can't put on this YouTube channel because I try to stay positive. You know why that happens? That happens because they're making profit out of people's sickness. United Healthcare needs to stop doing that. And other companies need to stop doing that. Other health insurance companies don't make money out of people's sickness. Make money out of trying to help people stay healthy. When people go to a hospital and say, I need this, I need surgery, it's too late. At that point, you have to pay. No choice. You can't say, oh, no, we're not going to pay for that. When the doctor says, if you don't get treatment, like happened in the case of Natalie, if this person, she needs a liver transplant right now, we recommend that. This is going to work. It's been working so far. You say, no, we don't have enough. No, you just have to go through the treatment. It's too late at that point.
What's the conclusion on this topic?
In conclusion, I would say this. Health insurance companies need to begin putting patients first. They need to stop putting patients last. If you want next time to have so much popularity that people say, wow, I love my health insurance company, sort of like the way the British love their NHS, okay? Even though it's public health insurance. If you want that as a private health insurance company like United Healthcare, which is very large, change the perception from cutting costs to patients first. Patients number one. Everything else is secondary. Once you've put patients first, then you can figure out, okay, now that we've put patients first, how do we make money from other things? And some of those suggestions that I've suggested in this video can be very helpful. There's so many ways of making money outside standard healthcare. There are many private healthcare companies in Canada that make money. There are private health insurance companies and even clinics and so on that make money in the UK, in Germany. They have those companies and they make money. Companies don't lose money just because they offer better care. They just need more innovation. They need more ways of thinking, much more creativity. You can create new ways to make money without screwing the patient. That's what, when boards discuss a thing, when managers, senior managers, executives, if you're an executive and you're listening to this video and you listen to it, I really would implore you, take patients first. Study other countries. Go to other countries and look, oh, how do they make money? In spite of having universal health care. How do they do it? Because that's how you should be thinking right now. I personally do not blame the public for their reaction. I think that it was deplorable for killing Brian Thompson. But I don't blame the public for reacting the way they did. Some people, some commentators were blaming the public, tried to accuse the left. It wasn't a left and right issue. You go on Fox News and they're talking about the same thing, and you go on MSNBC, and the voices were similar at the disgust of the behavior and the moral bankruptcy of the health insurance industry. And this needs to change. And it can change right now. You can either take lessons. There are some CEOs that I saw, I've forgotten their names, I'll put them on the list, who reacted quite well to the reaction. They said, it's understandable why the public. These are people who are CEOs of health companies. And then you had Andrew Whitty, who reacted like, I don't care, I'm going to double down. Okay? No. I hope that Andrew Whitty was maybe under just that feeling bad and depression of losing somebody who worked with you, a work colleague. I hope that's what was happening, and later on he will rethink these ideas and maybe come up with something better for the United Health Group. But if what he said is going to be fulfilled, it's not going to help. I also urge our politicians to do something, to change the system, to not just take money from these health insurance companies and do nothing or slow down change, but to implement change immediately. You can double down and say, oh, okay, this is what it is. This is what we're going to do. We're going to fight back against this. This is so negative. These people are so deplorable. No, people had bad experiences. People lost their moms, their sister, their girlfriends, their boyfriends, their wives, their husbands, their partners. People lost someone because of lack of health insurance or bad health insurance. I have friends that have died because of lack of health insurance, or they had bad health insurance. By the time they went to the hospital, it was too late. When I was young, I had a friend, and I'm not sure whether he's still alive, who I'm pretty sure he had a lot of issues even at that age. He was already overweight, had a lot of issues. And I remember calling the ambulance for him. So I called the ambulance, and when the ambulance came, because he had health insurance, but the deductible was going to be so high, he refused to go on the ambulance. He said, no, I'm okay. I'll stay here. I later heard that he had been more sick. The point I'm trying to make is we have family members, people who have had problems navigating the system. Heed the public. Anyway, thank you all for watching, and I hope you have a good week. And I'll talk more next time on this health insurance, because this is a topic, and if something else comes up, I might talk about Syria. Syria has been another interesting one in the future, and about what that means for Israel. All the best. Thank you.